Good morning. Welcome back, everybody. Well, today's show is all about, it's a new year. Maybe you're thinking about a new you. And if you're suffering from pain, you know what? You need to fix that, and you need to get some help. And there is so much help out there. And joining me right now is Dr. Doug Yateman from aascend Pain Institute in Appleton, and he brought along one of his colleagues. And today we're going to talk a little bit about how to get rid of that pain in the new year and stop the suffering. Good to see you, Doctor.
Thanks for having me.
And who'd you bring along?
I brought Dr. Randy Blahoviak. He's a chiropractor I work with very well. Past fall, we've been talking about different things that pain clinics do to help bring down pain. And I have a lot of patients come in, well, what about chiropractors? I always tell them, chiropractors work well. If they work, great. Things I do don't always work. You got to try something to see if it works for you. So a lot of patients I'll send to a chiropractor on top of what I've done to prolong the effect or help other areas I can't touch. So, and it's kind of a weird situation. I hear people all the time saying, don't go to chiropractor, don't go to doctor. They work well together. And if it doesn't work for you, try something new. And we've got other things we do as well. But I try to show people, here's what we do. Here's other options. We always have other options to help bring the pain down. And that's what we're trying to do. So that's why I brought Dr. Blahoviak here. And he's going to go through what he does, since I don't do it. And we'll go through that. So,
what do you do, doctor?
Wow. That's
a loaded question.
That's a great question. You said we have, what, 4 minutes? We can get that all in. You know, chiropractic is a pretty simple philosophy. It's based on the structure and the function of the body. If we can help the body get back to functioning the way it's supposed to function, correct any mechanical disturbances that we have there, relieve pressures on nerves, we can usually relieve pain and get you back to a more normal lifestyle.
Like how many sessions sometimes does it take? Can it be as little as one?
It can be as little as one, and it's, you know, it's individualized to the particular patient. I always tell people we're changing body systems, and it's just like working out. Typically, you can't go to the gym one time and come out looking like Arnold Schwarzenegger. We'd all like that, right? But it just doesn't happen. Generally, you have to stress that system over a period of time to get the changes that you want.
Typical pains that you're seeing that you can help no problem.
Neck pain, headache, stress, right? Tension headaches, a lot of that going on this time of year. Lower back pain, and a lot of people think chiropractic is just for the spine. Well, you know, it's joints anywhere. So knees, ankles, elbows. Pretty much anything musculoskeletal you can get dealt with appropriately chiropractically.
Really? Headaches too? I did not know that.
Oh yeah. A lot of headaches are muscle tension oriented. So if you have an area in the spine, particularly the cervical spine or the neck, that can cause a lot of irritation to the nerves. The nerves cause the muscle to spasm. Muscle spasm gives you muscle tension headaches. So if we can get back to the source of that, relieve some of the mechanical dysfunction in the neck, you can take care of the headache pretty quickly.
And I was talking to both you guys. A lot of people think chiropractor, is that covered by insurance? And a lot of times it is.
In fact, the state laws say that it has to be covered by insurance. So yeah, there's no question there.
I love to hear success stories, so how you guys were able to work together, because suffering from pain is no fun, you know, especially as you're getting older. You know, I have mother-in-law who's just, it's a constant thing, and it's just she's not the same person. You don't have to live with that. Tell me about, something that just, a patient that just was, wow.
Well, one of the patients, actually one that Randy sent to me, was doing really well, but just was not doing as well as it used to be. The guy has pretty bad back, and actually he's on my ads. So he came up, I did a few facet blocks, put the fire out, and Randy just kept it going longer. He's playing racquetball, he's doing stuff. I see him once or twice a year. Yeah, so he's doing really well. He was scheduled for surgery. So we've put off surgery for a couple of years.
That's great, and that's what you guys are all about, right?
That's exactly what we're about. You know, the two professions work great together. You wouldn't think that, and people always ask, well, how can, you who doesn't like medicine and you who does like medicine get together and work so well together? The bottom line is it's about the patient. You know, I don't care who gets the credit for getting you well. You know, just like your steak. You could season it with just salt, and it would be okay. You could use just pepper, and it would be okay. But if you combine the two, you really end up with something a lot better than what you would if you just used individual approaches.
Got it. You guys are great. Thanks so much.
Oh,
good to see you. Happy New Year.
You too.
Appreciate it. aascend Pain Institute. Dr. Yateman Blahoviak, nice to meet you.
Thank you. Nice to
meet
you.
All right. Take care.